again, how to do a physiotherapy and other activities.
Actually, there is some confusion about the terminology. The stupid midwife got the first picture someone was delivering. She doesn't look like paramedic, nurse or other paramedic. It looks like a traditional birth attendant. The first picture you showed was someone is delivering. And in the presentation, first that very person looked like a traditional birth attendant. And we have in our context as well, the definition of the midwife is a fixed one. Who will be considered as a midwife? So I think that terminology is a bit confusing. I mean, it's not in collaboration with British Nursing Council.
Okay, I would like to say about it, when we started our program, first challenge, the biggest challenge was to bring the mother out of their home and reduce the home delivery and bring them to the facility. So main ultimate goal is take them to the hospitals, facilities. But they were really afraid to go. That's why we started these delivery centers. But still starting the delivery centers, mothers were not coming for deliveries. Then we tried to target them, how we can bring them out. So from the local community, the traditional birth attendants, they depend on them so much that they would prefer to die in their hands rather going to the facilities. So that's why we use them as a cadre that bring them out of the house and bring them to the facilities, at least to the delivery centers. And then, but there were many malpractices of the traditional birth attendants. And then we named them urban birth attendants. We trained them, we told them the do's and don'ts. And this how,
that's
but the paramedics.
Birth attendant, that's fine. And you get it. It's not the midwife. Right?
Yeah, no, it's not the midwives.
And the same thing is those which you showed later, the two-story building, or it is something like the slum with better.
Yeah. Well, I didn't have much picture here, but some areas when we work, the challenges is finding a place, good place for delivery, or a nicer place. So we try to, this is one of the pictures. Some are also with the tin shades, some are, but they have to be a bit better than their slum lifestyles. So fortunately this building we found near the slum areas, because you could see beside there were tin shades, and those were all the catchment people.
Patients from the Harmonic College are referred to Dhaka Medical College. So from our experience, the complicated cases who are referred to Dhaka Medical College, they are referred very much late and so many bad complications. So we have questioned that the training capability of the persons who are delivering those mothers is in question. So I think I request the BRAC, just please ensure or upgrade your training facility for those GPAs who are delivering the mother. It's a question I just almost dying that coming to the
That's why this presentation is from BRAC Delivery Center to upgraded center that is called BRAC Maternity Center. And gradually we will change these all delivery centers, and TPS are just transition. And gradually when these paramedics, they are trained, they will be able to handle and they will cover all the working areas. Gradually that's the demand. We also face the challenge, that cannot be done. So that gradually we are changing, shifting. This is just a shifting process, shifting time.
Is here. So I think the BRAC should also make a collaboration with the Nursing Council, because whenever you use a term of the type of provider, that should be important. So thank you.
I'm using satellite.
Now I would like to request Mr. Fedosi Islam, head of the Gynae and Obs Department at Medical College.
audience. My topic is obstetric fistula program and way forward. You all know that Bangladesh is a densely populated country where the maternal mortality and morbidity is still high. And if you look at the causes of fistula, so prolonged obstetrical labor is a direct cause of fistula, but the underlying factors are the social factors. And the low status of women and girl child community plays a very important role for causing obstetric fistula. Actually, we don't know what is the number of fistula in Bangladesh, but there are estimations that it may be between 71,000 to 400,000. But we have to do new estimation to know the actual number of fistula cases in Bangladesh. If you look at the life cycle of the fistula patient, they born in crisis and they die in crisis unless they are rescued by the fistula program in Bangladesh. And look at this poor girl. She is a fistula patient and she doesn't know why she has developed fistula and for where she has to go and where she will get it. So this is the way of the miserable condition of the fistula disease. And the main problem of obstetric fistula is because a lot of cases, more than 71% of cases are delivered and sold by some unskilled person. So that is the main effect of fate of the fistula cases in Bangladesh. So why we approach this fistula obstetric globally there are three approaches: there is prevention, treatment, and rehabilitation with advocacy and awareness. And the National Fistula Program in Bangladesh also adopted this approach to manage fistula in Bangladesh. And to focus on the preventive strategy, Bangladesh government has expanded the emergency obstetric care and decentralized the emergency obstetric care in the up to the grassroots level. And doctors and nurses are trained in emergency obstetric care. Not only the doctors and nurses, but also our AWDs and AWAs are also being trained as a community field work attendant. And there are also other programs like demand-side financing, maternal health, sponsor scheme, and also like breast. There are some other NGOs that are also involved along with the government to provide safe food. And also on the progressive experience as the community participants in the maternal health for improving the safe delivery. This is the expansion of the emergency obstetric care is up to the Union Health Center. For treatment, those patients who have already developed fistula in the government sector, we have 10 fistula corners in the 10 medical hospitals, and in the non-government sector, England Health also provides 5 fistula corners in the private non-government sector. And this is the National Fistula Center in National Medical College Hospital. That is, we have the Bangladesh government with the help of UNFPA has developed an independent almost 7,000 square feet area for a fistula center. It's a very big center. Very soon we'll be going to open this center. In this center, we have a dedicated separate 30-bed capacity of obstetric ward for the fistula patients, separate post-operative theater, post-operative centers, and a training room. And since the inception of the National Fistula Program in Bangladesh in 2003, up to December 2013, total number of 3,200 cases are operated, and majority is in the Dhaka Medical College. That is the National Fistula Center. Not only the treatment, development of human resource for managing the fistula patients is very important. For that, National Fistula Program has got a very good structured training program for the doctors and nurses. And up till now, up to 2013 December, 199 doctors and 203 nurses are already being trained on management of fistula. And besides the treatment, rehabilitation is another important for these social outcomes of the fistula patient. And the rehabilitation center is developed nearby the community college, It's run by an NGO, BWHC, and up to 2013 December, 720 fistula cases are rehabilitated in the center. And in this rehabilitation center, the fistula cases, they are actually given some training so that they can survive their own livelihood. And for that, you know that there are some home gardening, they are giving training on adult literacy program, swimming, laundry, and all these things they are given training in the rehabilitation center. And this is the model of reintegration which is done just not to treat them, but to rehabilitate them, so that these cases have both physical and mental well-being, not just physical and mental, but they should have some economic solvency, so that they can survive as a woman in the community. And this another program is going on. That's a very good program for community involvement. Is the community fistula advocate. These ladies are the who are the cured cases of the fistula, and these ladies are working in the community level to prevent fistula and also refer that already fistula patients to the definite centers where they can get treatment. And in this community, the community fistula advocate, they communicate with the community skilled board attendant and guide them so that they don't develop obstructive labor and they can save themselves to develop fistula. And this is the different activities that are going on in the community to develop capacity of the community fistula advocate. And these advocates actually they are the volunteers, and they are given 2 days orientation course by the BWHC, and after going back in their community, they develop their own livelihood, and also they communicate with the CSB, and also they refer the cases to the nearby fistula corners or into a home. And what are the successes since the development of the National Fistula Program in Bangladesh? Is that Bangladesh government has already endorsed oxygen fistula as a preventive technique. And as a part of the National Fistula Program, Dhaka Medical College, they have developed a National Fistula Center, an independent center of excellence for the treatment of fistula and the training of fistula in Bangladesh. And also, there are 10 published 10 fistula corners in the throughout the country. And I have already mentioned about the rehabilitation and the reintegration of the fistula patients. So, by preventing, by treating, and by rehabilitating, this is a comprehensive holistic approach to save our neglected women in Bangladesh. And not only that, because the training, you know that fistula surgery is a skill surgery, and for that training, continuous training is going on in Dhaka Medical College. So, in conclusion, what I would like to emphasize that the government of Bangladesh recognized maternal health as a priority health issue, and the establishment of the National Fistula Center is one of the most important health initiatives in the world. And we hope that this National Fistula Center in Dhaka Medical College will be a unique one of providing service and training for the fistula. And in near future, we hope that this center will be a center of excellence not only in Bangladesh but also in Southeast Asia. So we want obstetric fistula free Bangladesh. Thank you.
Thank you, Professor Dr. Singh, for the excellent intervention. Now, the floor is open for question and answer.
Actually, Dr. Singh, Madam, could you please explain what is fistula and what's happen with this problem? If this type of problem is explained to the non-medical personnel, then it would be helpful to assist the community.
Actually, I was understanding the fistula program, but I didn't focus on what you mean by fistula. Actually, fistula is the communication. You know, we have urinary tract and also we have genital tract. If there is any abnormal communication between the two tracts, so that the women develop continuous dribbling of urine, that is a miserable condition. I think you can understand. There is a communication between the urinary tract and the genital tract, if it is the case of urinary fistula. But if there is an abnormal communication between the urinary tract and the genital tract, that is called the fecal fistula. So the common fistula is between the urinary bladder and the vagina. We call it vesicovaginal fistula. And another one is though it's less common, there is the rectum and the vagina. We call it rectovaginal fistula. But the main cause of the fistula is the obstetric labor. You know, those women who are delivered at home and the presenting part actually presses on the urinary bladder and the vagina, and that part is actually becomes loss of blood supply and cause ischemic necrosis. And ultimately that part is plucked out and the patient develops continuous dribbling of urine. Actually, there are two types of fistula. One is the obstetric fistula, that is the outcome of the obstetric labor, and another is the gynecological fistula, that is the iatrogenic fistula.
Is there any other questions? I just want to clarify, madam. You said about community fistula advocates. Are they the cured fistula patients or
Cured patients.
cured patients?
The cured fistula patients. When they go back to their home, in that community, they work as a community fistula advocate. And for them, there is some training.
That is an excellent
Yeah,
idea.
it's
Because all the time, when a patient suffers from fistula, she is always having a urinary smell with her. So there is one saying that a fistula patient has her home at Gwalghar. She have to stay with the cattle because she is so dirty. But when she can be rehabilitated in her own place, that's a great rewarding event. Thank you very much. Now I will like to call Amit Pachpal. Amit Bharpal, yes. He is from Harvard Health Initiative from the Nehru Memorial Hospital, India.
Program basically has vision of women and men choosing the timing and number of their births with methods and providers of their choice. When we talk about timing and number of births, that we are not talking about limiting a family size. We are talking about couple having the choice to have their children as per their needs and as per the facilities available around them. The goal is to increase contraceptive use and reduce unmet needs, because many cases we have seen that people are desperate to opt some of the family planning methods. They are not available to them. So we are trying to address that, and by that we are trying to improve the health and survival rates of women.